Do, 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 do. Do, 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 do.
Hi, I'm Jennifer Lyall.
I'm Dr. JJ.
And welcome to Vitamin Junkeys, where we're addicted to health.
We are addicted to health.
Today we're going to be talking about botanical medicine.
Yes, ma'am.
And instead of JJ taking something today, you have something for me to take.
It's your turn.
It's my turn.
We finally, after I don't know how many episodes, you finally get to take something.
Yay.
So today Jen will be taking rhodiola, sometimes referred to as Russian ginseng. For those of you who are familiar with ginseng, ginseng is an adaptogen, so rhodiola, similar to ginseng, is an adaptogen. It helps you with times of stress, energy, etc. A lot of different therapeutic indications for it. Also, some people use it for weight loss, which is interesting. So we're giving it here to Jen because I find that rhodiola seems to work a bit better for women. So hence, Jen, being a woman, gets the rhodiola.
Interesting little bit of flavor still when you take it.
Oh yeah? Is it
Yes.
nice? Is it?
It's okay.
It's okay?
It's okay.
It's okay.
It tastes like most botanical medicines, not very good.
But they're yummy then. So
But they're good for you.
they are.
So what is botanical medicine?
Okay, so botanical medicine is herbs that are put into a form that we use for therapeutic use. So for example, a botanical medicine could be anything from a tea to the raw herb itself to a botanical tincture. So that's where we'll take some part of the plant and put it in alcohol. Also, you could get it in capsules in different forms. So this, for example, yeah, is a form of botanical tincture. This doesn't taste good.
No.
This is not good. But it's very good if you have a sore throat or like an upper respiratory tract infection. That's very good for that.
Just that particular combination you're referring to.
Yeah, this one right here is very good for that combination. What's interesting, too, with botanical medicine is about approximately 35% of most drugs actually come from plants.
Oh, really?
And that's where it started from, was the botanical uses. So aspirin actually comes from white willow, digitalis, so the digoxin, which is a medication we use for people with congestive heart failure, actually comes from a weed by the side of the highway called foxglove. So there's a number of these out there. There's atropine, which is from belladonna, and stuff like that. So,
Wow. So who prescribes botanical medicine?
Basically, you'll see naturopathic doctors, herbalists, some medical doctors, but for the most part, it's usually in our realm. So naturopathic doctors, herbalists tend to be doing botanical medicine.
Doctors of Chinese medicine?
Yeah, that's true. Doctors of Chinese medicine will also do herbal medicine. However, the method of prescribing is a bit different because typically the way we do Western botanical medicine, which is what it's referred to, usually it comes from the Greeks to the Germans to the Americans to us. The Chinese tend to follow their own traditional Chinese medicine, so it's based on yin-yang theory and the meridians and so on. It's kind of its own different, separate medical, but they do that too. You are correct. Thank you for the correction.
Interesting. So are there particular ailments that botanical medicine is good for?
It could be used for a number of therapeutic indications. I think in many cases, wherever there's a drug equivalent, there's also botanical equivalent. I'm sorry. So, for example, if you're taking something for a sore throat, there's a botanical equivalent for the sore throat. There's botanicals for arthritis, for blood pressure, for headaches, for pain, etc. So there's quite a lot of therapeutic indications that you could use botanical medicines for. However, you have to be very careful with some botanical medicines because some of them may interact with your medications. So that's when you should see someone such as myself, a naturopathic doctor, because you definitely don't want the medication you're taking to interact with the herb and make things worse, or have it interact with the medication and actually the medication stops working and then your condition gets worse. So you have to be careful with that. So the one we commonly see in the literature is St. John's wort, where we find it kind of throws off drug levels, so you have to be very careful with stuff like that.
Now, how would I know what botanical medicines to take? I mean, something people commonly take is echinacea when they're sick.
Yep, yeah. Well, something like, say, for example, echinacea is it's a botanical that has a pretty okay safety profile, so we don't usually have to worry about it too much. In most cases, people that use echinacea, it's short term, they use it for a week, when they're sick, then they stop using it. That's fine. For the majority of botanicals, you should really check with someone before you take it because you have to be careful. As I mentioned, there's a drug side effect. Also, sometimes people take these things that are, instead of helping their disease, they're actually making it worse.
Oh, wow.
You really should view botanicals as drugs. They really are drugs. You don't usually take botanicals for prevention. You usually take them to treat something specific. So when you're doing that, either you've got to know what you're doing, or your doctor's got to know what you're doing, and hopefully your doctor is a herbalist, a Chinese doctor, or someone like myself who knows exactly why they're giving you these things. So be careful. Don't just go and try, oh, let me try today. So,
Wow.
yeah, yeah.
So where would I get botanical medicines? We looked at the tinctures.
Yeah,
We
we've got
also...
this here. You could get botanical medicines on most health food stores. In this case, you have, this is a nice little mix here. You've got some Jamaican dogwood, which some people use for sleep and some people use for pain. In your case, you're using it for sleep.
Skullcap, lavender.
Yeah, skullcap is very good for anxiety and calming people down, so that works very well. Lavender is very good too, and has a nice little aroma. You could find herbalist stores, specialty stores, a lot of places you could find, and online too. Although if you're buying a herbal medicine online, you want to make sure you know specifically the brand you want. So your doctor's recommended this brand, because in some of the smaller communities, they don't have health food stores. They may not have the variety that we have in the bigger city centers. So if you know a specific brand, then you could go get that online, but don't go brand shopping online. That's not safe.
But if you see a naturopathic doctor, then you would develop a specific tincture for whatever ailment. Like, I know when my family gets sick, my naturopath will develop a tincture for that specific.
Yeah, that's one of the things we do in naturopathic medicine too. We have these neat little apothecaries where you combine, I want to practice apothecary, and you just kind of grab a little bit of this, a little bit of that, and you mix it all together and you put it in a bowl and give it to the patient. So you could give something, say they've got a sore throat and their ankle's bugging them and they have a fever, so you could give and some insomnia, so you could combine all the right herbal medicines to treat that. It's kind of neat.
And it tastes disgusting.
Yeah. They rarely taste good. I'm accustomed to them, but for the most part, they're kind of nasty. Yeah.
I tend to mix.
But they work.
They do. They are very effective, but I tend to mix it with some juice, and that's the only way I can get my kids to take it, is to hide it in some juice.
It's tricky with kids.
It is. Wow, that's very informative. Now, if you'd like to find a practitioner, you can go to our website and click on the Find a Practitioner link. Our website address is www.vitaminjunkeys.com.
And while you are there, please join the addiction and subscribe to our weekly podcast.
Thank you very much, JJ, and thank you for joining us. I'm Jennifer Lyall.
I'm Dr. JJ.
And continue the addiction to good health.
Do 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 do. Do 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 do. Do 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 do. Do 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 do. Sweet to the tongue.